Good morning. My name is Tammy Hines, and I am a licensed psychotherapist in Nashville, Tennessee. I work in the Middle Tennessee area, which covers some rural areas for our state. In 2009, I was one of the lucky recipients of loan repayment through the National Health Corps, whose specific goal is to address and remove some of those barriers to good, not only health care, but mental health care and dental care. I opened up Bellevue Behavioral Health Group in April of 2018. And one of my main goals for opening up my practice was to address the desert of services that was around the city. I don't believe that your zip code or your financial status should determine whether or not you received good health care. I do take Medicaid. I do work with children. I do show up because a lot of people, especially in the Black community, there is a stigma associated with mental health care. I think that by me being a practitioner and seeking out other Black and brown practitioners, it helps some of my clients come to mental health services and see someone who looks like them, which is another way to remove this barrier. I made sure that my offices were on the bus line because I am sensitive to the fact that most of my clients might not have transportation and they might need to take the city bus. Another way is if they say, I don't have transportation, I don't have money for the bus, I am one of those therapists that don't mind picking up a client to bring them to the office or doing in-home services, which is another way to remove those barriers. I also work closely while I was working in the rural area through the National Health Service Corps. This is where I saw my first transgender client, and it encouraged me to familiarize myself with the population. And I worked to not be culturally competent about this population. I worked hard to be culturally proficient. And this, the word got around, and about 5% of my patients are part of the LGBT community. And about 1% are adolescents who are choosing to transition to a different sex. I also work with ex-offenders, which is another population who I feel face a lot of barriers to good mental health care. I supervise a contract with the Federal Bureau of Prisons of those individuals who are transitioning from incarceration, who have struggled with substance abuse issues, and they need to find their way back into the community, which is another way that I help to remove some of these disparities of healthcare. I think a lot of people come to me because they see my experience and they also want to come to see someone who looks like them. I don't think we are sensitive enough to those people because a lot of them aren't familiar with what it means to go see a therapist. So right out the gate, I try to make them feel comfortable about the decision that they have made. Some of the other populations that I do work with is I work closely with the Metro Nashville public school system and some to become a really good referral source for their leadership and teachers. I also do a lot of networking. I am called the social butterfly of Nashville, Tennessee, because I think it is very important for me to know resources in my area because I can't do this work by myself. So these are some of the reasons and some of my goals and some of the research that I've done to help remove these disparities of health in my community. And I hate that I only had 5 minutes to talk about it because this topic is one that I'm sure we could go back and forth for days. I appreciate you giving me this platform, and I hope that this is the information that you were looking to gather. Thank you.